Open this up.
Okay. Good morning, everybody.
Good morning.
Morning.
I shall introduce myself first and ask everybody else to introduce themselves so we all know each other. I'm Ted Molson, Chair of the Council of the Isles of Scilly.
I'm Barbara Jones. I live in St Martin's. I'm Health Watch.
Joel Williams, Councillor and Lead Member for Children and Young People.
Bob, you?
I'm Bob Dawson. I'm the Officer for Policy and Scrutiny supporting the committee.
Jonathan Smith, Councillor for St Martin's and Smart Islands Lead Member.
Adrian Davis, Councillor for St Mary's, Lead Member for Adults.
Fran Grottick, Councillor for St Mary's and Vice Chairman of the Council.
Hello, Alison Hernandez, Police and Crime Commissioner for Devon and Cornwall.
Are you observing or partaking? Are you observing or partaking?
Observing.
Right.
Watching.
You're watching. Right, we've got everybody that's partaking introduced. If you could introduce yourselves, I'd be grateful. Thank you.
Yeah, we'll do. Hi, good morning. I'm Jackie Pendleton. I'm the Chief Officer from the Clinical Commissioning Group.
Good morning, I'm Sheena Arthur, Locality Manager for the West of Cornwall and Isles of Scilly with Age UK.
Hi, I'm Jill Thornton. I work for the CCG supporting the Better Care Fund.
Thank you very much indeed. The first item on the agenda is to...
Sorry, can I...
Oh, sorry. Yeah.
Oh, sorry.
Good.
Sorry.
I'm on the phone line. It's Caroline Coulds. I'm Interim Director of Public Health.
Sorry, Caroline. I didn't realise we got somebody on the phone as well as video. My apologies.
Okay.
Okay. First item on the agenda is to elect a chairman for the forthcoming year. Have we got any proposals, please?
I'd like to propose Councillor Joel Williams.
Have we a seconder? Seconded by Councillor Davis. Are there any other proposals? No. In the absence of any other proposals, congratulations, and it's your meeting.
Thank you very much. Good morning, everybody. Item number 2 on the agenda is election of Vice Chairman. Do I have any nominations for that post, please?
I'd like to propose Councillor Davis.
Thank you very much. Do we have a seconder for Councillor Davis?
I'll second Councillor Davis.
Any other candidates for the position? Deathly silence in that case, then I think, Councillor Davis, you take on the role of Vice Chair. Look forward to working with you. Does that...
Can you just introduce Ashley?
Oh, yeah, everybody. Aisling Hick has just joined us. I'll let her introduce herself.
Hi there, Aisling Hick, DCS and DAS for the Isles of Scilly. Hi, friends. How you doing? Sorry, I'm a bit late.
And we've got Caroline on the speakerphone.
Hi,
as well.
Caroline.
Are you there? Caroline, are you there?
Yes, I am. Sorry, I was trying to remember to unmute myself at the right time. Yes, I am. Hi, Ashley. How are you?
Can I just clarify? We've historically had almost a deputy chair. Did we get around it by having Councillor Davis now as the...
Yes.
So we don't need that?
No.
Fine. If we move on to item 3 on the agenda, which is declarations of interest.
I have one. My wife is a volunteer coordinator for Age UK, which has been discussed later.
Okay, thank you very much. Any other declarations of interest people would like to register at this stage?
No.
Thanks very much. In that case, we'll move on to item 4, which is minutes of the previous meeting. I wasn't present at that, but if anyone's got any factual accuracies they'd like to challenge or any matters arising, please feel free to comment. Councillor Grottick?
I'd just like to say that I believe several of these people actually attended by video link, and normally we actually do note whether people were physically in the room. I don't know whether or not it's important, but I just thought I'd mention it.
I'll look to Andy Thomas whether he's got any view on that. Do we just put a VC or an asterisk next to them in those circumstances?
I think you operate a bit differently to what we do at council, because I think you rely on people to be rely on attending from the mainland to make these meetings work properly. So I'll take a bit of advice from it, but in the meantime, leave it with me.
Okay.
I think we should note, please.
Fine.
Could I just ask who chaired that meeting?
The previous chair, which was Councillor Saville.
She gave her apologies.
She sent her
But he
apologies.
was, is it Manda?
As vice chair.
Right.
Okay.
Thank you.
Thank you.
The only matter arising I had was on page 2, and it was in reference to CAM's transformation. There was discussion about a potential visit and views of a board that sort of visit would be very worthwhile. I just wondered if that had happened or was likely to happen.
So, Chairman, Lola's no longer working there, so we've got Liz Cahill, who's a new Children's Commissioner, coming over to the islands, hopefully in early September, where we'll go through CAMs and also some of the SEND inspection findings. So, yeah, that's in the diary, and I think Liz Cahill's going to be really, really good news for us. She's got a fantastic track record and really wants to get under the skin of issues for children on Scilly. So watch this space. I'll bring a report to the next Health and Wellbeing Board, maybe.
Yes,
yeah,
please.
That'd be really helpful. Any other comments on the minutes of the last meeting? In that case, can we confirm there's a true and accurate record and take a vote on that?
I'll propose.
Anyone willing to second the minutes? Thank you, Councillor Grottick. I think that takes us on to item 5 on the agenda, which is urgent items, and I'm not aware of any. I don't know if anyone else has got anything they would like to raise. No urgent items. In that case, we'll move on to part 1 of the meeting, which is verbal update from partners. I'd like to perhaps encourage us to go around the table and give a brief overview of what our agency or organisation is doing, and perhaps with relevance to Scilly, if at all possible. Can we start with you, Caroline, perhaps?
Yes, certainly. So, issues relevant from public health. I think you're probably aware the public health grant from the Department of Health is continuing to reduce by 4% per year. So that is something we are having to manage. The Public Health Annual Report will be coming out in the next few weeks. This year we're focusing on housing and its influence on health. That will be a report for Cornwall and the Isles of Scilly, but there will be some specific data around the Isles of Scilly and the issues of housing that you face there. The other thing that's important really is the alcohol and drugs needs assessment. That's specifically for the Isles of Scilly. The work's been done for that, so there's been a data collection and some interviews. And obviously there is some caution in interpreting data when you have such a small population. However, I think there are some issues that are coming out from it, some concerns around alcohol. I mean, you have 70 licensed premises on the island, so that's a high density of premises. And 6% of crimes are alcohol-related. There were 2 alcohol-related deaths in the past year. But that said, there are few referrals for alcohol treatment. So I think there's some issues around that. And there will be an action plan put together. And that will then feed into the procurement process which is underway for a new contract for our the contract that's currently held by Ad Action for March 18, so March next year, and that will be a 5-year contract. So I think what would be good if that needs assessment comes to a future Health and Wellbeing Board, as in fact the annual report does as well. I mean, it's just unfortunate with the timings that neither of those are quite ready for this meeting. And then the other things that are relevant, there's no particular health protection issues relevant to the Isles of Scilly currently underway. And then a lot of the other work for public health has been around shaping our future and the prevention work stream, looking at the wider determinants of health, healthy lifestyle, so alcohol I've already mentioned, but also smoking, obesity, physical activity, and then a work stream, a sub-work stream around self-management of long-term conditions. But I know taking our futures on the agenda, so there's probably not anything more I need to say at this point. So any questions or comments?
Any questions or comments from partners?
Hi, Alison here, Police and Crime Commissioner Caroline. I just wanted to ask, because we've learnt quite a bit in trying to deliver services to the residents on Scilly, and I just wondered through your procurement arrangements for the drug and alcohol stuff that you just talked about, how the wording in some of that procurement is, just to get you thinking really, because there's two ways to look at it. Is how does Scilly residents access the service, which means everyone's got to leave the mainland to go and access the service. It's more, how do we deliver the service on the Isles of Scilly? So it's just thinking about that wording side of things in terms of encouraging more of the services to deliver on Scilly rather than them having to access it over on the mainland. It's just a bit of food for thought really on that procurement process.
Yeah, I think that's right. I think there has been quite a lot of thinking going on. And that's the same with a lot of our services, whether that's services to schools, etc. And I think it's already gone to Cornwall, the Safer Cornwall partnership. But I think you're right. There's a bit more thinking that needs to be done on that.
Just to say, it's Aisling here, at our recent community safety partnership meeting, we discussed the needs assessment in some depth. We have got a commission service through Addaction, and what we have now got is an island-based detox programme in home. Because we have found a dislocation of accessing services on the mainland. It's just not appropriate. And actually, there's been discussions whether that detox programme might be appropriate for Cornwall residents, kind of getting a break from chaotic influences. The other thing is that we have got commissioned worker, but that has been patchy over time, and keeping track about whether or not they come because of weather has been really tricky. So there's now Caroline's team are going to report to me much more regularly whether Addaction are actually coming, because it's all very well me thinking there's a worker every week, which is meant to be happening, but actually knowing that for a fact, because we actually have had some learning that actually people have found it hard to access those services, particularly over winter months when transport is a nightmare. But we've got Steve Slade in place now, who has also got experience for young people too. So we're hoping. The thing is, you're not going to get referrals if people don't believe there's a service. And then we find this over and over again on Scilly. So until we kind of get some traction behind that service and people know it's there, and there's a kind of word of mouth that this person's all right and really helped you out, no one's going to refer about something so very private. So we've got Steve Slade working very closely with primary care so that the referral happens within that building and that he's set up in there. So we're hoping to see over time a bit more going on. I mean, I think a big conversation we have is whether that worker should actually be recruited locally or should be coming from the mainland. And it swings and roundabouts because there's this whole thing about it needs to be confidential. However, I've got resident social workers who live and work in the community, and because they're trusted, that's fine. I've got GPs doing the same, we've got nurses doing the same, so you can do it. And actually, I just do sometimes worry about the fly-in model because, look at you today, you might not get away. And our workers often have clients on the mainland that they're also worrying about seeing. So you're dead right. Those issues of how do we deliver here? What technology? Surely. Peer groups, that sort of stuff, I think, we definitely need to explore in more detail. But we're working with Angie, aren't we, Caroline? And I think we need to keep a real track on what exactly we're getting for our money, because I think we spend about 19,000 in the public health contract for Addaction, and I want to check we're getting value for money. Thanks.
Brilliant.
Thank you very much, Caroline. Anyone else got any observations or comments to make? So it looks like we'll have an agenda item in the near future around the drug and alcohol support services, and also what you alluded to in terms of housing will be very topical for us as we, as an authority, look at increasing our housing stock. So that's going to be very useful.
So that's the Public Health Annual Report, which should come to the Health and Wellbeing Board anyway.
Thank you very much. Can I just ask when that report about housing is likely to be published?
I would say August is a little bit difficult, but I'm hoping it'll be in the next few weeks.
Okay, that's good. Thank you.
Jackie, Sheena and Jill, can I bring you in if you've got anything in addition to the reports you're presenting in due course?
Yeah, do you want me to do a general update on CCG?
Please do, yes.
As always, we'll start with the money, the same as Caroline did. So start bad and get better, hopefully, as we go through the conversation. So you'll know from previous reports how financially challenged we are. We finished last year with a deficit of just over 54 million, which was, albeit a significant deficit, it was exactly as we forecast we would. So we delivered the savings that we said we would during the year, and they amounted to about 21.4 million. Now, that's a significant increase in savings compared to any previous years. It equates to about 3% of our budget, and prior to that, we've delivered less than 1%. So significant improvement on our position. It's fair to say going into this year, 17-18, we still don't have a signed off and agreed plan with NHS England. we have been given something they call a control total, which is effectively the overdraft we're allowed to have, of 19.9 million. And to get to that position, we have to deliver a savings plan of 29.6 million. So again, another quantum leap from what we did last year, and it's fair to say the plans we've got to deliver that near on 30 million are not without risk. So there's a significant amount of risk to get us to that position. However, NHS England are saying they require us, at the moment we've got a gap of 17.7 million still to get down to that control total. And we're having ongoing conversations. We had the National Director of Finance here last week. They still want us to make inroads into closing that 17.7 million gap. Now, our position at the moment is we don't have a credible plan for that. So short of slash and burning services, which we clearly don't want to do, we want to do this in a sensible way. We haven't got a plan for that, hence why we don't have an agreed position with NHS England at the moment. We're doing everything we can do. We're looking at, obviously, how can we make the savings by actually improving the quality of care. So we know that we're in a position where we spend more on, let's say, hip and knee surgery, but actually our outcomes are worse than other parts of the country. So not only are we spending more, we're not getting great outcomes either. So how do we improve the quality and thereby reduce some of the costs in that? We know our prescribing costs are higher than other places in the country, again, looking at comparable populations, so we can do more. So how do we work across all of our practices? Obviously, for you, it's nice and focused, but how do we eliminate that kind of clinical variation between people to make sure that patients are getting the right care when they need it? So lots of work going on that. As a result of that, again, you've probably seen some of the media coverage. The CCG has an annual rating from NHS England, and it's kind of predicated on a number of things. The financial position, which is clearly not good. We're rated as on behalf of the system almost in terms of what are the performance and quality issues. You will know that we failed to meet the emergency department target for many years, way before me arriving here. We've also got some challenges at the Royal Cornwall Hospital. As you know, they've had a couple of CQC inspections. We're still awaiting the report from the one that they've just had. So the CCG, in effect, gets judged on that because as a commissioner, we should be able to help them resolve some of those issues, which is, what our role is in the system. So not surprisingly, with all of those challenges in Cornwall and the Isles of Scilly, we have been rated as inadequate, which we're disappointed about because we've made significant progress. I highlighted some of the achievements around the financial position, but we've made significant progress around the governance, the staffing levels within the CCG from when we were put in legal directions in December 15, but we still remain inadequate, sadly, as a reflection of the position the system is in. Now, what NHS England have told us is that every CCG in the country that's inadequate will be entered into something called reframed special measures. Now, what they can't do is actually tell us what that means at the moment. So the only information we've had back is saying you need to get a turnaround director, you need to undertake a capability capacity review, and you'll be entered into this thing called the capped expenditure process, which is what I've talked about with the financial position. We've already done all of those, so we can't understand if it's just another word for the legal directions that we're already under, or whether it will mean something additional. They've not been able to articulate that to us, so we'll let you know when we know. Otherwise, I guess most of our activity is focused on getting the Better Care Fund in place. We'll talk about that later on the agenda. Obviously, the guidance came out incredibly late, particularly to the health sector. I know the local authority side got guidance much sooner. And also shaping our future. We're very, very clear that unless we do the transformational work needed, we won't ever close the financial gap. We're not going to close that level of financial challenge by just nibbling around the edges. It needs a fundamental change. So we'll come on to that later in the agenda. I guess it's worth just noting a quick update because I know NHS England aren't here or on the call. I know that the local pharmaceutical service provision has been sorted out in an interim measure at the practice in terms of allowing the Helston Medical Centre to act as dispensing doctors. So I think we all know that's a short-term fix to the problem, and they are recruiting a replacement pharmacist. So again, we're hoping that once they've recruited, we can revert to the previous service, but at least it does ensure that we have some access to prescribed medicines on the islands, which is obviously important. But that's it for me. Happy to answer any questions.
Can I, from my previous professional life, I'm actually a pharmacist by qualification.
Oh, okay, right.
Ask why it needs to be a registered pharmacy in a rural situation like we are, because that then limits the access to medicines for patients, full stop, because you've got to have a registered pharmacist on duty.
Yeah. I can't answer that other than that's what the LPS regulations state. So not only do you have to have one, as you say, you've got to have the second one in terms of head of pharmacy. So, yeah, I mean, those are NHS England's rules. I can go back and ask if there's any discretion in that, but I suspect not.
Can we not just leave it as a dispensing practice?
We can do. I understood from your perspective, though, that means over-the-counter stuff people have got to wander down the road for.
That wouldn't be a problem, because that was how it happened in the first instance.
Okay.
Councillor Grottick.
May I suggest that we bring a short report on the pharmacy issue to the next Health and Wellbeing Board, please, Chairman?
From whom?
Well, I'll throw that into the.
I mean, I think I'll talk to Dr. Garman, but I know that when primary care services were commissioned nearly 5 years ago, pharmacy was something that we weren't. No one's been happy with it, both in the community and all the GPs. And actually, how it was working was really good. But there was a real kind of commitment from the commissioning team, who was led by a pharmacist, that we should have a pharmacy. And actually, in practice, it makes no difference to the customer, but actually it's about access. So dispensing GPs makes total sense, and I think that's what they'd like to see when we look at the kind of a recommissioned service
of the contract. Okay.
Yeah.
No,
I'll check that out. I don't want to speak on behalf of the GPs, just in case they've now kind of changed their mind, but I think they are. Yeah.
Okay, and I've also got a meeting with NHS England later this morning, so actually I can pick that up with them as well in terms of, can we look at that as a more permanent solution?
Fantastic.
Okay.
Fran?
I was just suggesting watching brief, no enormous piece of work, just an issue that is obviously of community concern, and obviously the board would like to be up to speed. That was all, nothing to add.
And I think there's a bigger picture here, because if we're starting to look at the integration of services, it's looking like about kind of medicines generally, so in our care home and in the hospital. Exactly. And then I think given the kind of timescales for all those contracts in place, actually we've got a good opportunity to think about the whole piece. So rather than reinvent a service for the short term until the contracts run out, can we sort of do the most pragmatic option, which is probably for the GPs to continue to do it with additional resource so they're open in the afternoon, and then think about it in a bigger way.
As part of the 2019 recommissioning. Yeah, okay.
Exactly.
Okay, that makes sense. Yeah.
Thank you very much.
Okay.
If we'd like to go around, colleagues over in the video conferencing room.
Yeah, I can give a little bit of an update. Obviously, I've got a bit within the agenda, but just some developments that we're working on that relate to Isles of Scilly, if I may.
Please do.
Thank you. So our helpline is up and running and working well, and we do have people from Isles of Scilly that have been using the helpline, which is a good support via the telephone for people. We're also developing that with an idea of an online portal, and very much trying to use technology more at Age UK. Not something we're great at, but nice to join you today using technology. And the online portal will be a way of people navigating support and information as well. So as long as they have internet access, that would be available, and it's available for anybody within the community, professionals, family members, individuals themselves, as a way of navigating and accessing services and support. We've also had some digital champion training through the council, very much looking at the future when a lot of the services are going to be online, and that's something we're keen to develop within Isles of Scilly, particularly thinking at the people in the most remote areas, how we can use technology in different ways to connect people. And we had an event at Helston Hospital recently where our Living Well coordinator joined that event, really for a bit of learning and ideas sharing, and that was with the physio and OT team, looking at rehab within the community, so trying to support people to move from hospital quicker, to get home, to look at the link with our day service and community services, and how we can support the work of the health practitioners in terms of reinforcing the messages for patients and supporting them to be empowered to do their physio, not just when they've got that one-to-one physio appointment. So that's really been the main developments relating to Isles of Scilly in the recent couple of months. I was really interested to hear about the work in terms of drug and alcohol support, because we're finding quite a lot of our referrals through the helpline and within our other teams are relating to people with mental health, drug and alcohol type issues. So we're looking at bits of training for our helpline team and how to support people with escalated anxiety and very particular needs. So we'd be really keen to work with the other agencies to look at how we support people with those sorts of issues. The other bits I'll leave to the next part of the agenda.
Okay, thank you very much. Any queries, comments, observations colleagues would like to make? Thank you. I'm delighted the sort of interconnections might have some benefit if you're able to pick up with other partners and improve the work you're doing. That's always a great outcome from this sort of meeting. So thank you very much.
Yeah, thank you.
Jill, did you have any updates you'd like to present to us?
Just probably about the governance wrapped around the BCF really. I don't know if you're aware, in March we had an internal audit regarding the Isles of Scilly and the Cornwall BCF, in which there were some recommendations, and we're trying to follow up on those recommendations. I don't want to really go into the schemes because I suppose that Aisling will do that earlier on, but we are trying to wrap around the Better Care Fund, improve governance and support from the CCG. So we are aligning some of the work we're doing on mainland to ensure that it also encompasses the Scilly residents and make sure that they benefit from that as well. So I think we've got the first submission due by the 11th of September. So we've got quite a tight deadline because of the recent issue of the guidance, but we seem to be working well with that, and we're also liaising with Martin Body at Cornwall Council. Okay, thank you very much.
I've got to know about, can I just say that Jill, we'll go on to the paper, but Jill's been an absolute hero in helping with this.
I'll pay you
later. Yeah, thank you.
Okay, thank you very much. So we might come back to that on item 9. Barbara, could you give an update perhaps on Health Watch activity?
I can. Obviously, for those who don't know, our chief lady on the healthcare is on bereavement leave at the moment, so I have just a small written statement to give to you. Certainly, concerning the experience of cancer patients, which was sort of is an ongoing thing, we've made a report to the Health Watch Board about the need for accommodation at Trelisk, but for logistical reasons this has still not yet been discussed. The Health Watch Board has decided there's nothing further that we can do to advance the case for affordable accommodation at Trelisk. However, we have spoken to Anna Burton, who is at the Cornwall Isles of Scilly Cancer Patient and Carers Group, and understand it is still on their agenda. We believe that they are better placed than us to forward it to our CHD. We're making a separate task to understand and report on the experience of cancer patients in Scilly, and this is a very informal situation, but it's having good results. People really do tell us the problems they have, and they have to go over to Trelisk for quite a length of time. That was the main thing. We're still supporting the physical exercise programmes. This is all done through the gym that we have here, concerning the rehabilitation of patients after they've suffered injury or health problems. Chris Douglas has been very forward in doing this. We're not doing very well because the problem is we have to have supervised exercise rather than them just being taught what to do and then going and doing. And this takes time and this costs money. So although it's a very well-meaning thing, it's not working very well, I'm afraid. The medical travel, which is always a huge problem, basically we now join up with the Silly Medical Travel and Transport Group. They are getting there for some things, and particularly, I must say, with the off islands, which is good. And we're going to do a community feedback. We're planning a postal household survey in autumn and expect to be able to make the report in the new year. We do this usually once every 2 years, and people really do write down what they maybe won't go and say, and it does help a lot for us to understand where we are here. Thank you. Any questions, anybody? Try.
I haven't got any direct questions. However, related to what you were saying about medical transport,
yes.
I'm aware that there was supposed to be an announcement on non-emergency patient transport as of yesterday. However, that has been pulled and no announcement been made about it, from what I understand. I think there are an awful lot of very, very nervous people on the islands that we cannot find any information about what's likely to be in it or what's not. There's been very little consultation about it, and it appears as though there is something that is going to be unpalatable, I think, is the feeling that's abroad at the moment. And I'd just like to put everybody on warning that there could be something, I might be wrong, but there could be something within that is abhorrent to the residents of the Isles of Scilly.
We've already got a concern around children because once children turn 16, they're no longer entitled to an escort. Mm-hmm. So obviously there's partly because children have rights to privacy, so they should be able to travel on their own at age 16. That's equitable with the rest of the country. But for some appointments, it's absolutely appropriate they will take an escort. Obviously, you could turn 16 in September of year 11. If you have regular appointments, which some of our children do, they would need to go on their own. If they get fogged in, the idea is that to mitigate that risk, Volunteer Cornwall would meet them at the airport and organise B&B. We do not think, in the light of issues like child sexual exploitation, that it's appropriate for children to be staying in a B&B on their own, age 16, and especially if they have any kind of special educational needs or disabilities. I've made contact with the chairman of the Safeguarding Board, who's written to an NHS Kerno. I understand their position, but we need to have a discussion about that because it does pose a safeguarding risk. And even in space of the deficit, the amount of money that would cost in any given year is not something I think that would be detrimental. I've also become aware that children accessing orthodontic treatment referred by a dentist rather than by a GP also have to pay for their own travel, as well as the escorts. So you're basically making access to orthodontic treatment unaffordable to most people. Most people can't afford to be away every single month for 2 nights plus accommodation. So I think those things, I was going to pick those up with Liz, but I think we're going to need to ramp up some of our concerns around medical travel. We seem to be going backwards, having made some huge strides. We used to have GPs who could recommend escorts on a clinical basis, and what they said went. And now we seem to have that conversation with people in the patient transport office. When we had our recent workshop, there was a real, there was that whole thing about the coordination of what's going on for patients at Trillis came up quite a lot as well. So there's a whole piece of work to be doing here.
Could I just add a comment, please, as well? It's very true what you're saying, Alison. We have huge problems at the moment with the dental service in terms of people who need service for their dentals, who cannot have it here and have to go over, as you're saying. And also, the problem is really happening. It's not just these 2 services we're talking about. It's with many, many services. And very recently, John Garman, our doctor, did say, when we asked him, that in actual fact, quite a number of people are having appointments and saying, I just cannot go because I cannot get an escort or I cannot really pay the money out. We can't I know we all blame the weather for everything, but you know, sometimes it can cost £500 or £600 if you have to stay overnight, which invariably this is what people are doing. You go the night before as you've come here because the weather's bad, and then you have to stay somewhere, and then you have to rearrange transport coming back. And if you're really poorly, which people are if they're going for appointments, they find it really difficult to arrange all these things if they haven't got somebody as a support at their side. And it is, John Garman did say that it is becoming a serious problem, that people are just not looking after their health because they're just saying, we just cannot do it. So I know escorts have been talked about for years and years and years, but it is becoming a very difficult problem over here. Thank you.
As we are in the 21st century at the moment, I'm afraid we're looking at a system that is actually not fit for purpose.
No,
I hate to use that phrase because it's very much hammered by press and what have you, but this one is now becoming a serious issue with patients declining treatment. I've had people on the phone to me in floods of tears over this, and we're talking about patients that have refused to go for chemotherapy sessions because they can't afford it. Now, that's not acceptable.
No.
I know personally of that experience with somebody on St Martin's.
Exactly, and it really is not acceptable. And as I say, I am very, very nervous about the potential announcement about non-emergency patient transport. There really is something in that they don't want us to see at the moment, and that's why it's been pulled, I think.
Absolutely. Yeah, I agree.
Adrian?
I would strongly support what's been said. This is a 21st century phenomenon, which is due to economic situation. I can categorically say it never happened in the last century. No. Having spent some years here, this is a new thing, and the health service is failing our patients and this community.
Yeah.
And something's got to be done about it, and I hear what Ted says, and if we do have bad news, we've got to stand up.
Mm-hmm. Colleagues, we're joined by, in the equivalent of our public gallery here, by Councillor Mumford, who's chair of the Council Scrutiny Committee, and I'm sure she's all ears in some of the discussions which have been taking place. But they are massive issues, aren't they? Yeah. Which have massive impact on people's lives on a day-to-day basis, whether it's sunny and warm or cloudy and foggy as it is today.
And I would back up what Barbara says. We're dealing with sick people here, and then we're being judged by people who, no disrespect, are healthy and perhaps haven't had that impact. Until you've actually been ill yourself or had somebody close to you ill, and live over here, you don't realise what an impact this has on your life, which is obviously going to produce more ill health.
Thank you very much, Barbara. Alison, perhaps over to you next.
Yeah, well, I can talk a little bit about some form of emergency transport, actually, in my update, but I'll let Lynn do the details on it. One of the reasons I'm here is because when I came and visited the island last time, both the chairman and chief executive, I said, what is the one thing I could do to help you? And I wasn't expecting the answer to be, please come to the Health and Wellbeing Board. But maybe there is something that's really special about this meeting that might be important, because normally there are other ways that I can help people. So I'm just sort of laying that out there, that if there are things that you need my help in any way, you have to remember I have a commissioning function as a police and crime commissioner, and I want to protect the most vulnerable in our community from abuse and exploitation. So if there are ways in which I can help in any way, do consider me in part of the conversation or maybe part of the solution to sort of help you along with that. I think in terms of, it was really great when I was here last, because I dropped into Health Watch and we had a really long conversation, particularly about how Scilly residents would access services if they'd been a victim of a sexual assault. So we've been working really hard, and we're hoping by the end of this month that we're working with Skybus to be able to get people who want to self-refer without having to tell anybody on the island, that they can leave and go and get them their support if they've been a victim of a sexual assault. Is there anything specific that you want to update, Lynn?
So I came across to the Community Safety Partnership meeting earlier in July, and I brought with us providers from First Light who provide the domestic abuse support advocacy service, together with they run the Sexual Assault Referral Centre for Cornwall and the Isles of Scilly. and we are really keen to ensure that the service is accessible to people on the islands. And we recognise the difficulties of confidentiality of the island, because there is a service whereby if people want to report to the police, access to services is arranged through the police support service. However, those people who are not confident, who don't wish to disclose what's happening to them to the police, how do they access services and get that support? So First Light are really keen to establish a service. So we've been helping them. So people will be able to self-refer into the service. Now, it may well be, if you're a victim of rape or serious sexual assault and you're within what we call the forensic window, so there is forensic evidence that can be recovered from you as an individual, we are looking at facilitating the transport off the island to the Sexual Assault Referral Centre. Now, I know that means taking people off the island. And if there is a need to bring the service to the island, we can accommodate that. So if there's specific injury or it's an elderly person or whatever, that can be accommodated. But we had a meeting with Skybus earlier this week. We're looking at the method in which we can set up the transport system to get people off the island in a hurry, and with necessary escort if needed. And also we recognise the difficulties with accommodation as well. We don't anticipate there being many people who want to access the service, but we are keen to make sure it is accessible. We will be testing the service as well before we make it available, because quite often I've seen comments before, this looks good on paper, but how does it work in practice? So once we got the referral pathways established, we will be working with the partners to make sure the system works so that people have confidence in accessing that particular service as well. And as Alison's already alluded to, we hope to have that service established properly by the end of this month.
So that was so in terms that we obviously at the moment we don't expect to have loads of people referring in for sexual assaults, but I think the issue is, and I was just on City Radio this morning, is actually just talking about it, letting it be known in the community that there's a service, is all the things saying we don't tolerate it here.
Yeah.
You know, it's one of those things to help actually push that message out that it's not tolerated here. So I think that's really, really helpful that we've managed to progress that far, and really it was thanks to Visiting Health Watch raising it really as a big issue, that they really like to see more support there. So thank you to Health Watch is what I'll say on that one. The other couple of bits, just as an update for you from me, is that generally you might hear that crime is increasing, because it is nationally, but also particularly it's increasing in Devon and Cornwall around online crime. So we have an increase in violence without injury, the category that's recorded as that, because more and more people are reporting the abuse that's happening to them online. It's positive thing, but obviously it's seeming like there's more crimes. I think it's more the fact that they know they can report on it now and actually get some assistance. The other thing is as well, Her Majesty's Inspectorate Constabulary, don't worry CCG, you're not the only ones. We were actually inspected on our crime data integrity, which is, you know, whenever you talk about crime statistics, nobody believes them, whether they've gone up, gone down. Everyone's like, well, all I know is what I know in my community, and it doesn't feel like that in my community. But in terms of the crime stats, we were not the best at recording crime properly. So we would safeguard the victim, we would make sure that they were supported, but we may not have properly processed that information to record it as a proper crime. We were only 83% compliant. Now, if you were a business, 83% compliant ain't that bad, but it's pretty poor when you're talking about crimes, because it's so important to people that we record it properly. So there's a lot of work that's gone in over the last 6 months, which is a bureaucratic process in policing, and a lot of resources that are taken to record crime properly. We're looking to have improved that, but that will have also increased the crime statistics, because we're instead of flagging, what we used to do is have a master crime, and all the little subsequent little ones that were connected to it weren't recorded as a crime. You now have to record everything. So everything's becoming a bit more increased in terms of what the public perception would be. So that has been a bit of a challenge for us, and we're still not there, and we're probably hoping to move towards 90% compliance, but I don't think we'd ever get to 100% unless I took loads of resources and encouraged the Chief Constable to put police officers on it now and keep going, because you're talking about a recording process, and as long as people are still being supported and those that need to get justice are able to, I think that's the important bit. The other thing I wanted to just say is that the police are recruiting at the moment. So again, I've just talked on Radio Silly about anyone wanting career change. All ages welcome. We've just had a 50-year-old pass out. So don't think that you have to be 18 and young. So we're looking for people who have had a life. So just wanted to highlight that because there's a big recruitment process going on at the moment. I'm investing 24 million over these next few years and trying to increase officer numbers. So we're trying to take them back up to 3,000. And so one of the really big pushes at the moment is making sure we're replacing people who have retired and we can try and keep our numbers up. So there's an opportunity at the moment with that. And then finally, I was at a meeting yesterday, Local Criminal Justice Board, and I've established this subgroup which is around mental health to better support people who are mentally unwell who are going through the criminal justice system, and also to stop people who are mentally unwell unnecessarily entering the criminal justice system. Those are the two main objectives. And I did hear that there was a recent Section 136 that happened on the island. I think it might have been only a week or so ago, where somebody had to be sectioned, and it went really well. So I just wanted to highlight good practice. I know there's some policies and procedures that are being picked up to take it forward, to formalise it, but apparently it went really well. And so I just wanted to share that and say well done, because it's great to hear.
Thank you. It's an amazing piece of teamwork. The whole policy was coordinated by my adult social care manager, who's now left. But it was a real triumph. And actually, but the thing is, it was about relationships on the day, and everybody did their bit. And nobody said, that's your area of expertise. Everyone believed it was theirs. And then that's what I want for mental health, that people don't run from it. They go, I can help you as much, and I know my limits as well. So it went really, really well, and that person was supported without stigma, with total dignity, and everyone worked really well together. And we're now looking at that pathway for young people as well, because we've got slightly different challenges there, because obviously our hospital can only have people for up to 4 hours for children because of their physiological differences. So we're looking about what the pathway might be for a young person. But we're learning all the time. And the Section 136 was so hard to do on Silly, about awareness, where would you support people, who's the resource. So we've got our children's social worker came and helped. We had people who work in our care home came and helped.
Wow.
Yeah, it was great. It's a real triumph, and no one knows that stuff because we can't really talk about it. But no, that's fine.
Just continuing on, and Aisling will back me up. I've been banging on for years about a registered place of safety. Have you got any money?
No, we have got one. No, we've got it. That's all sorted. We can't ever have an actual.
Yeah, no, this is for the children I was talking about.
For children, we're having those conversations. It's completely around medical, clinical governance. Yeah. Right. It's not safe for children to be in our hospital.
I'm just trying to tap her up for some money.
I know. But I think if we could come up with a solution. Right. The thing is, we now have a foster carer. So our belief is that that person could support the child while we get transport together. So the issue is how long we've got. If it's kind of 24 hours, 36 hours, and you can't go by sea, where would we support somebody? Yeah. But with a child, we also are going to try and get an agreement that health will come here, whatever the weather. They're just going to have to. They're going to have to bring the gold-plated services here. Actually, a lot of them we keep rehearsing endless scenarios in our heads. So what would we do? What would we do? Yeah. So I think that's what we probably would do, is get them here.
Yeah, and it sounds great with this foster carer, because one of the things that we've done through this subgroup is we've already talked about, well, what's the definition of a place of safety, and is our definition of it incorrect?
For a child, it's somewhere where you can watch telly and play on an Xbox, actually, safely. That's what I don't think. And that's probably in someone's home, probably their own home. Yes. But maybe parents need a bit of support because they're tired and they've got siblings. So is there somebody else that can do it? Yeah. So again, my children's social workers, because an inclusion worker, our hostel parents. So it's just rehearsing in our heads. Yeah. What would we do if we had 36 hours, 12 hours?
And this is why the Isles of Scilly is so good, because you try and come up with the creative solution to ensure that that individual is going to be supported. You don't get this conversation everywhere, so it's really, really helpful to hear it. Okay.
Well, I'm really pleased to hear about the work you mentioned about domestic abuse and also the success about multi-agency work. Barbara, did you have?
No, carry on.
Okay. Any brief observations on that?
Can I just say, Police and Crime Commissioner's Office input into Community Safety Partnership is fantastic, just across the piece, and Lynn's been stars are. So I feel Community Safety Partnership is being like a completely different meeting, isn't it? Like, we're just achieving a huge amount. And for the next Health and Wellbeing Board, we'll bring a report, because of course we want that kind of governance there. We'll bring a report on all the things we're up to, how we're spending the money. Yeah. A big focus on domestic abuse.
So I've done a big push of ensuring that we at least maintain the level of funding to Community Safety Partnerships or increase where possible.
Exactly.
So that because I'm really big supporter of community safety partnerships, because that's where the effort and energy lies to actually practically do stuff.
Yeah.
So I'm really pleased to hear that, and I know that Lynn and Joe and my team as well are really, you know.
And in Ted's absolutely fantastic point about more money, we're coming up with a little project maybe to look for additional resource.
Okay.
Yeah.
Push it through, Lynn.
I just wanted to say, I think it's quite interesting when we brought up the place of safety, which has now been going at least 18 months, 2 years, how few people realise that it exists, and the way that we made it exist over here, because varying groups got together and said, we just have to have this, you know. You can't let somebody go in well, we don't have a police station, but you know what I mean, on the mainland, there's a police station where they go. And everybody had joined together. So, you know, you get the hospital and you get the police, you get the doctors, you get the paramedics. Everybody has a place to do it. They all know what to do, and I'm delighted to know that it's all well happening.
But as Aisling alluded to, nothing happens by accident. A lot of work goes on behind the scenes.
A lot of work goes on behind the scenes.
And Aisling and I have pushed for this for a long time, because the police cell is entirely inappropriate place for mental health issues, and unfortunately it used to get used over here, but now it's so the one that I am pushing, and I will push you for as well, is for the youth. We have unfortunately on the islands we've got a large proportion of mental health issues amongst our youth. We recognise that. However, we haven't got necessarily the resource to back it all up at a time, but I will push you for extra resource if you will.
Please do. Please do. I mean, one of the things, just so that you're aware, is a lot of police and crime commissioners signed a letter to Sarah Newton, who's the MP responsible for vulnerability, around places of safety and the use of custody. Because obviously in the Police and Crime Act it says you're not allowed to use a custody as a place of safety for young people. And the letter was about, we don't ever want to use it for an adult. But I've said, actually, in extreme circumstances, if it's the only place we've got, it's got to be the place to use. So I did not sign that letter, but many PCCs did. But just so that you know, because I do recognise we all have a part to play, and if it's in an extreme circumstance, I think we'd all say if that's the only option.
Pretty good hospitality at our custody suite, to be honest. So.
Slightly different to a normal one. I know, I appreciate that.
And it's about those issues of dignity. And,
yes.
We can maintain that in any building, I think. It's about a way of working and shared values.
It's about confidentiality as well. On a small island with everybody knowing everybody, that is one of the biggest problems. And you do have to have that.
And Councillor Munson, I'll pick up your point about mental health issues of children in bits as well.
Aisling, would you like to give any more update in addition to what we've
really briefly, because I've got some papers in here. I've covered addiction now through an earlier conversation. As you know, Cornwall just had the special educational needs and disabilities inspection by Ofsted. We were fully expecting for them to come and peel away and come here, because that would make sense, because they're already talking to my health partners, but they're probably going to do it again. So we're braced for it to happen in September. Had really good conversations with Liz Cahill and Emma Corlett, and we're auditing all our cases, so we'll be as ready as we can be. It's not graded. I think we know ourselves inside out, and I think what we're trying to avoid is having to write a statement of action after the event, so we're going to have our action plans ready. So that's pretty positive, and I think in having these conversations, I think we're going to have some better joint working with CCG anyway. I've talked about the travel and transport issues, but they're very live. And to be honest, if Ofsted were to come in September and talk to our Parent Carers Forum, they will have their ears chewed off specifically about this stuff. So just to warn you, I'm Better Care Fund. There's a paper here about future funding, but I've still got to close down last year's. The governance around Better Care Fund has been atrocious, and I'm really, really glad that we've got this framework now. And I think what I really would beg of this board is that the Better Care Fund is the kind of board's responsibility, it's not kind of mine. You've got to hold the providers to account. They're not services that I am providing. You need to make sure you're getting value for money, you're getting the outcomes you want, so that we have that clear audit trail about how we spend public money. The biggest single risk we have to the health and care system on the Isles of Scilly is the sustainability of residential and domiciliary care services. As you all know, I had a lovely time a few months ago when it looked like we might be facing closure. due to the threat to safe care because we had such significant workforce issues. We have stabilised the service, but we still have recruitment issues. I'm still trying to recruit. We've done videos. We're all over the place trying to get those care staff. Members have voted to purchase further housing, but they're still live, so we are not out of the woods. I've got my registered manager starting next week, and I should have a full adult social care team in place in by September. But at the moment, I think I am feeling that fragility of services on the islands, and it is all about people working together. But when I lose those key people, it suddenly feels like, oh my goodness me. And on foggy days like this, I really start worrying. So it's just, I think, as we think about shaping our future and one vision for children, I think the big issue here is about resilience of services. And then, is there anything else I was going to about? Yeah, that we recently held a workshop hosted by Hitachi, who are one of our strategic partners, and they've got a whole kind of health and social care bit to their organisation. So they facilitated a workshop around integration, at which there was some really strong attendance by all the key players. Probably could have done with RCHT there because a lot came out about discharge arrangements in at Trelisk. But it was well attended, and I think the conversation between Andrew Abbott and my chief executive has been that almost constitutes wave 1 of the soft consultation. So we'll join in at wave 2 and 3, but I think we don't want to do consultation exhaustion, you know. So I think that's it for me. Mental health for children, that's one last thing. A couple of years ago, our CAMS reported that we had 18 children accessing specialist services, which is disproportionately high for a child population our size. So we've done a lot of work around early help and about equipping a wider workforce with mental health skills and understanding. The local authority have commissioned a family support worker in the school to have early conversations with children and families. We have got 2 people trained in school in Thrive assessments, and we also got the whole Bloom model set up here where we have a multidisciplinary team meeting discussing children and working out who could do that piece of work with a child, and it doesn't have to be someone from CAMS. If it should be, it should be. But anyway, now working with CAMS, we have 7 children. I think probably of those 7 children, 4 of them probably wouldn't be with CAMS if they had been able to access what we're doing now. There are the 3 or 4 who are absolutely appropriately accessing specialist services, but otherwise, you know, and I think that whole early help model has got to be part of our kind of one vision plan, because that's what works on Scilly. Because as you can hear, medical travel, etc., the minute you start taking people off island is when you put your cost in. I will shut up. Not too much.
Thank you very much. Bob, did you have anything you'd like to add at this stage?
No, fine at the moment, thank you.
I've saved elected members till last. If we could briefly, if there's anything, Ted, you'd like to add?
I've got nothing. I've got stuff coming up on the agenda, but nothing immediately.
I'd just like to reiterate that I'd like to see what we can do to move forward on the housing that we agreed that we would buy access to support carers.
I'll support that, certainly.
Yes, so we're hoping to sort of try. I mean, we have lost Diana Monfloki, who is a key player in support for that, but hopefully we can move forward as soon as we can.
Absolutely, and I think maybe he's also thinking about what the partnerships with health could be here, because I know health providers have exactly the same issues with housing, and maybe we could do some joint working around getting housing for key staff on the islands. I'm not saying key workers, because that's a whole different can of worms.
Adrian?
Thank you. I can't really add anything to what Ashling's had to say. I must really start out by saying, you know, commend you what the work that Ashling's been doing. As you all know, we had this crisis at Park House not long ago. There's obviously a question of sustainability there, but we've recruited staff. Hopefully, it looks very promising in the short term, but the long term is obviously still questionable. I mean, it was on the main news this morning about the sustainability of care homes on the mainland, so it's not a purely, we tend to think that all our troubles are local and caused by being on an island, but the national problem is finding carers and workers, and we're so lucky at the moment to have Aisling, who's so much on the ball, and you know, I can't really add anything to that except saying that the community was severely concerned, as we all know. We were through that wood, but we don't know quite what's in the future.
Thank you very much. Jonathan?
Yeah, just briefly, in terms of the Smart Islands project, Smart Energy Islands, the Hitachi project is up and running now, so that's all about installing renewable energy on social properties and improving energy efficiency in business properties, and also developing the infrastructure for the smart grid. So that's all up and running. There are quite a lot of links to sort of health and well-being, so I think I'm new to the board, so I don't really know the understanding of people in terms of what they know about Smart Islands, but perhaps it'd be useful to sort of explore that in the future, just do a sort of a paper perhaps to inform people.
I think that'd be really useful, if not at the next meeting, at the meeting after that,
sure.
Have direct aspirations between health and wellbeing and the Smart Islands project as an agenda item.
Yeah, so I'd really just sort of make that point at the moment, and look forward to learning more about the board.
Thank you very much for all your patience as we've gone through those updates. I know it takes time, but I think it's very worthwhile to hear what is going on.
It is the best bit.
It is. We now move on to item 7 on the agenda, which I think, Jackie, are you taking?
Yep, you've got me for this. I'm going to assume everybody's read the paper, so I don't intend to go through it page by page, but to just kind of give you an overview and then pick up questions. Some of you will know, obviously some of you are new members to the committee, but sustainability transformation plans, which I'll shorten to STP or will be here all morning, were something that NHS England required everywhere in the country to produce. They were set up as a 5-year plan over a geographic area, and for us the geographic area was agreed as Cornwall and the Isles of Scilly. They came off the back of the 5-year forward view, which was a national document published about the future of health and social care in particular, but not necessarily just limited to that. There are 44 what they call footprints in the country, and actually we're about the smallest. So in terms of our population size, I mean, it is what it is, but it is, combined only just over 550,000. So we are a small area to be doing this level of planning for the future. It's fair to say that originally, because this was very much NHS England driven, we were inundated with a whole series of forms to fill in, a bit like you're going to see later on the Better Care Fund, a whole load of fixed templates and a whole load of stupid deadlines. I'm really pleased to say now that that part of it has gone. We've submitted an outline business case to them, which we all know doesn't meet the requirements of an outline business case if we were doing it for ourselves, but it met their requirements, if you like. But now this is very much back in our ownership. So we have slowed the timeline down. I think we absolutely recognise in Cornwall and the Isles of Scilly that historically we haven't been brilliant at engaging with communities. So whilst other areas were actually able to hit the ground running because they've done all that groundwork with people over the preceding 2 to 3 years, we don't have a great track record in that in the CCG, at least I'm sad to acknowledge. So what we've done then is gone almost back to basics and said, OK, we need to co-design what local services are going to look like with local professionals and local people. So we've kicked off a whole range of engagement events now. You've got in the papers, Ashlyn said we were going to do a separate one on the islands, but we've actually decided the Hitachi event, because it was so successful, constitutes the first wave of that for you folks. And I think that's really important because it was designed by you, for you. So we need to make sure that it meets those needs. So we've concluded 6 other workshops on the mainland now. So we've done the first round everywhere. And the response from the people that were invited to attend, there were... Oh.
That was Caroline. She. I think it timed out.
Okay.
Do we need to turn that off? Hang it off.
G is up.
Have we lost Caroline?
It appears to have done.
Okay. I thought maybe we all started dancing midway through or something. I know you like to be different, so... Okay, so it's an invited audience at each of these workshops, and it's really local professionals. So it's been led by GPs principally, so that we get the clinical leadership from the local patch, but also other professionals, whether it's social workers, mental health workers, therapists, and a number of patients who are what we're calling experts by experience, so local people who have experienced local services and can actually talk quite knowledgeably about them. So the idea is that we'll repeat these 3 times, and gradually through that process, those local groups will help design almost what their out-of-hospital services might look like in their community. So not acute hospital services at Trelisk or anywhere, but everything else, including local beds in local communities. Now, that's quite a big challenge in 3 workshops. So where I've done this before, it's taken us 8 workshops to get through that kind of level of detail. So we're going to take stock after the second one in September and see how far we've gone. And again, you've got the dates for your September and November workshops in your paper. And then we'll see how far we've got and how much more work we think we need to do to come up with a long list of options for what local services might look like in each of those patches. Now, clearly for you, it will be unique because of your particular circumstances, but we'll still need then to kind of put the 7 bits back together and make sure the jigsaw works. So over here, for example, if we've got someone saying, actually, we want one of, I don't know, let's say some beds in this location, if the neighbouring patch has got them just the other side of the border, then does it make more sense to stick them together as long as they're accessible, that kind of thing. So we just need to make sure the jigsaw works. So I think that the most important thing to say is we are nowhere near making any decisions yet. I'd love to be there, but we're not. So we haven't done the work. This is genuinely now about bottom-up planning. We are not going to be in a position to start evaluating the long list of options till after Christmas. Some of that will be financial analysis, some of it will be estate, some of it will be workforce. And if we plan to make any significant changes, we then need to go through formal public consultation. So genuinely, we're probably talking about next summer at earliest before we're anywhere near ready to do any formal public consultation about major changes. Clearly, if stuff comes up from the workshops, and there were some really great ideas coming up in the local workshops that we can just get on and do, then we'll just get on and do if they improve things for people. But as I say, major changes, nowhere near decisions. We're probably a year, 18 months away from those kind of decisions being taken. The other thing noted in your paper is the new kind of buzzwords, isn't it? The NHS wouldn't be the NHS if we didn't invent a new set of acronyms. So you've got accountable care systems, strategic commissioners, accountable care partnerships. And again, I think the significant thing to say is you'll have seen, obviously, after the election, there is nothing in the legislation timetable that changes any of the CCG statutory powers or the fact that CCGs will need to continue to exist. So the moving towards any kind of accountable care partnership is about working more closely together so that the person receiving the services doesn't perceive those gaps between us. It's not about major reorganisation or mergers of organisations. For me personally, I kind of think if we start talking about mergers, our staff get really anxious and we get focused on the wrong things instead of the right thing. So actually it's unhelpful if we just go into, moving the jet chairs as the NHS tends to do every 4 or 5 years. So let's just focus on what's important for local people. But very happy to pick up questions.
Yeah, a number of bits and pieces, and I applaud the fact that we're looking at a seamless transfer and fully support the idea of cradle-to-grave care, that the patient doesn't get handed from one organisation to another. However, I am nervous about the potential governance in the future. We, as a moment, as an authority, have full determination upon the fact that we establish our, in particular, our elderly care services on the islands. I would not, and I don't think any of our elected members would support any transfer of that governance away from the islands. I think we've had, as we've illustrated a few moments ago, the potential crisis at Park House. All right, we're working our way through that at the moment with Ashton going like the clappers with it. However, it would be very easy to devolve that power to the mainland, and then in 5 or 6 years' time, somebody in a faceless committee in Truro, Plymouth or wherever, and saying that is not delivering concurrent value for money. We must avoid that at all costs.
Yeah, I guess my response, we sit here a bit like that as well, because everyone assumed before the election that, the CCG wouldn't be around any longer. So I guess we're kind of struggling with the same challenge, if you like. But I think that the key thing is you're the statutory authority. You decide what happens to your accountability. No one can force that on you.
What I'm saying, that we're not going to give that up.
Yeah, well, that's in your gift. So no one, the same as the CCG. We have something like 150 something statutory duties. Whatever happens, whoever we work more closely with, I'm still accountable for all of them. So we have to be really clear and make sure it works for each of us. So happy to respect that view.
Councillor Grottick. Excuse me.
Thank you. That's quite very reassuring to hear that we haven't made any definite decisions, and I would just like to say we do want to work together, and obviously we do want to reform the system. But we have had an election where we've got now 50% of our members are actually new members, and people are also, the existing members, in many cases, are doing different roles. So probably outside the remit of this board, but probably to full council, what I would hope is that we would very soon have an agenda item where we can have information regarding the progress and decisions made to date actually put before members so that we could all be as up to speed as possible. But I would like to say I totally endorse the chairman's view that local accountability and decision making must stay here. The people who put us in our seats expect us to protect that service provision at all costs. And speaking personally, and for everybody else, I'm sure that we would all want to do that.
Okay, I mean, whether you want it as an agenda item or Bob Ashton, whether you want us to come over and do a general briefing for members so it can be a bit more informal and we can just spend a bit of time, unpicking some of it. Very happy, whatever suits you.
Yes, I mean, I would defer to the chairman of council and to the officers and to the chairman of this board to see, and indeed the chairman of the scrutiny committee sitting there, to actually decide where best this might sit. But I would like that as a matter of urgency, because I actually see that as a very positive thing, because we do want to work together, but we actually need to know a little bit more about the road we've travelled already. And I'm pleased that we've made no binding decisions, but we need to know more about accountable care systems, and we especially need clarity. I see on page 10 clarity and governance arrangements, and I think we need to get in there at the outset and start exploring the different ways in which governance might impact on decision making locally.
Just to back up what Councillor Grottick said, I personally would very much like, if possible, you to come over and have a workshop with councillors to get us far more up to speed than we are, please.
Okay. Yep, very happy to.
Yeah.
Thank you, appreciate that.
And we were just saying there's potential to combine that with one of the workshops which is taking place to save additional...
Yeah, that would make sense, wouldn't it? Yeah.
I mean, I think also we want to sound really positive here, because we recognise there's a really fantastic opportunity on the Isles of Scilly where we already have a really good multidisciplinary way of working. We've got that integrated care team, we've got social prescribing as part of the model, and it's actually, given our kind of fragility issues around staff in community hospital and staff in Park House, there's an obvious idea here, isn't there, of them being one workforce. Yeah. And there's also and two buildings which aren't perfect. I mean, Park House is much worse. Surely there's a really nice estate idea. But I think what members are really keen is that by collaborating with partners, you don't lose the Scilly flavour. And because there's actually quite a lot of quality control we have by doing that. But we've got other models where we've done it. So if you look at Health and Medical Centre running our practice, you had no perception it was mainland. It felt very much like, and also we're doing the same thing. Our school is joining a multi-academy trust in Cornwall, but they're still going to respect the kind of core kind of diversity around being something from the Isles of Scilly, because we're proud of that. So I don't want you to feel that there's a negativity about the change, but it's just ensuring that the Salonian community feels that they have input into particularly elder care, because in March was a really sticky time, but it was really great. It was great for everyone, because what we realised was this is a kind of fundamental priority of the Isles of Scilly, which is that we will look after people for as long as possible on the islands and as close to home as possible on the islands. That's a big ask, but it's something we need to kind of try and fulfil.
Yeah, no, I didn't wish to convey any form of negativity.
No, none taken at all. But I guess I'd come back and just say, actually, you're not unique in that. That's what every community wants.
Yeah.
So your exceptionality allows us to test a few things there, because exactly as our police colleague was saying, it makes us think differently. And actually, then Exactly the same thing on the mainland. So
I think we've got a pretty good track record of pioneering stuff as far as that is concerned.
Exactly.
And test beds and things like that. I mean, Jonathan is our Smart Islands lead member, and he's keeping everybody up to speed with that. And what's more, it's not just here; it's going up the line to Westminster. I presume with NHS England, it'll go up to the people in Ivory Towers as well.
Yeah. Very much so, and I'm really clear out of these series of 7 workshops. If we end up with 7 plans that look identical, we've got it wrong, because our communities are not identical. You're unique, Bude's unique, Chururo's completely different. So it needs to, be absolutely appropriate.
Yeah, and I think it's just making sure, because our budgets are relatively small, but they are all we have, and the risk for us versus our health partners is much more significant. So our £1 million for adult social care, we need to make sure that what we're buying is absolutely right. We cannot afford to make a mistake. So while we're dead keen and want to get moving as quickly as possible, we've just got to get that detail absolutely nailed down. So if we can do that together, that would be brilliant.
Yeah, cool. Absolutely.
I've just got one question, really. I just wanted to ask what involvement the emergency services have had in the workshops or part of the conversations, because as policing, we're working really closely with fire and ambulance in the region because we don't have coterminous boundaries and complicated matters. So we work as a South West Emergency Services Forum, and the fire service, as you probably well know, have great capacity because fires are so few and far between. So there are opportunities to work with partners in a different way around some of this effort. So I just wanted to sort of flag it up if you have or haven't involved them, and if there's any way that through the South West Emergency Services Forum, if there was an opportunity, if you wanted to utilise that in some way, I'm sure we could facilitate that.
That's a brilliant offer.
Obviously, we work really closely with ambulance services as our natural partner. So the ambulance services actually sit on the various transformation boards and everything else. Right. Paul, as Chief Fire Officer, sits on Health and Wellbeing Board. Again, we do regular updates to the Cornwall Health and Wellbeing Board as well. And actually, Paul, and very locally, we've had conversations with him about exactly what you're saying. I know where I came from. The Cheshire Fire Service, I think, were one of the first people to actually start saying, if we could take the data that we have at GP practice level about, some of our long-term conditions, actually they could, if we train them, they are a workforce that can go in, they can check blood pressures, they can do all sorts of things if we just train them. So, we're having those conversations very locally.
Good. It's good to hear you mention Paul then, so I don't have to worry about Cornwall Fire.
No. Our Chief Officer as well.
Yeah.
Maybe our
Thank you very much. Any more points people would wish to raise, Fran?
Just a quick, I just wonder if we could add whether or not it would be helpful to make a formal recommendation at number 4. We're looking at 3 recommendations which note progress, and I think there is now a broad consensus that certainly council members would like a further workshop to aid communication regarding progress and decisions made to date. Could we have that as a 4th recommendation, that we actually set this up with your, thankfully, with your cooperation as quickly as possible?
Yeah, by all means.
Then I'd like to make that a proposal for recommendation 4, please.
I'll second that.
Yeah. Thank you.
Can we take those recommendations on block then to approve and second?
1, 2, 3 on the 4th.
Yes.
Yeah, I'll propose all 4.
Thank you very much. Jolly good. Okay, thank you very much for that update. Very useful. A lot to take in. A lot to move in the right direction. I think we now move on to item 8, which is the evaluation of. Oh yes. Do we need to formally vote on that one?
I think we probably do.
Okay. All those in favour of those 4 recommendations?
Do I have a vote?
You do. Yeah. I do as well.
Anyone against? Jolly good. Thank you very much. So that leads us on to item 8, which is the evaluation of Age UK Living Well project. Over to you.
Yeah, thank you. So within the report that's been submitted, again, as I'm not going to go through all of the report, but just summarise the main points within it, if that's okay. Hopefully you've had a chance to have a look at our proposal. The Living Well Isles of Scilly project has been running for the past 2 years, And really the aim of that was a proactive approach to supporting people at risk of losing their independence, and also trying to identify people before they reach a crisis situation. And really a key aim of the project is about connecting people and looking at existing sustainable groups, so not creating new projects but working with what's there within the community already as much as possible, and raising a sense of wellbeing. So wellbeing is a key focus of the project, empowering people to support their own wellbeing and increase their confidence within that. Throughout the period of the project, we have learned a great deal, and Aisling talked about it earlier, about the time it can take within a small community to develop the relationships and build the trust, and that's been a key part of the project, is focusing on establishing relationships with all aspects of the community and creating a profile that people understand what we offer and that they trust as well. And when I was over a couple of months ago, I really saw that in action, and it was lovely to see that referrals coming from different routes. So obviously a key part is through the multidisciplinary working through the team there, but also within the community. So, you know, going to the co-op's not a simple task for our Living Well coordinator, because there's people, you know, that might ask to speak to her, arrange to meet her later, local shopkeeper making referrals because one of our customers is looking a bit unsteady or in need of a bit of support, family members, and really that sort of eyes and ears of the community, which was one of the aims that you wanted from the project at the start, is really starting to happen. So that's, we feel, a real success so far. A key part of the project has been filling gaps, navigating for people, and as you're all well aware, you know, the professionals having limited time and resources, so really trying to link with the team on Isles of Scilly to spend time with people that maybe need a bit more support, who maybe need health messages reinforced, and supporting people with what their individual needs are and getting the best from the services. So that's been a key part of the role, is that navigating and linking people together. The key themes that we've identified, and that's really in discussion with everyone that's been involved and with across the wider community, is looking at potential for future, and some areas that we've identified are where there's gaps in provision and gaps within the community. And a big part of the conversation has been about the winter on Isles of Scilly, where things close down, people can become further isolated, and looking at the use of, you know, our bus is a key part of our Age UK team and provision. So how can we use that? When we met with our group of volunteers, they were saying, yeah, it's difficult in the winter because things close down, but it's brilliant because the roads are really quiet. So they're saying, you know, maybe the bus could get out doing trips for people that are isolated, reminiscing around the island, a bit of history of the island, that kind of thing, sharing and connecting people in the winter months, which can be a time that a lot of people on their own can dread that time of year. Very much thinking about building resilience. As I said earlier, a lot of the people we're connecting with do have, they might have health conditions, emotional issues, needing support, confidence building, and really trying to build resilience and supporting people with whatever their additional needs are. So linking in with Health Watch, with Add Action, with part of my role is a Macmillan team, so linking in with people affected by cancer and other conditions as well. So really building up that network of support. We've also identified a younger, older people group, and when I joined Age UK, I was a bit shocked to discover that older people are 50 plus. was like, wow, that's very young. So.
Ted's had it.
I've had it, I've gone.
So there's a real opportunity, I think, in working with that younger group, because certainly when I was over on Isles of Scilly, I spoke to people who were talking about getting older and seeing provision as something that wasn't for them. It was way down the line for them, but they were talking about, thinking about retirement and what's available for them. And it struck me there's a real need to engage with those people so that we don't lose them on the island, because people were talking about accessibility, contact with family once they retire and as they age. And there's a real risk that we lose all that knowledge, networks, the connection on the island. So I think there's lots of benefits for the island in connecting with that younger group, in informing the future service delivery, but also engaging with them and having a more positive attitude to ageing and getting older. And, it is a privilege to be in the position where you are getting older. It means you're here, you're alive, you're well. So having a more positive message about that is something I'm certainly very passionate about. And also getting that message as early as possible. So having that intergenerational work and linking with the new academy, with the scout groups, whatever groups. We've had a little taster in the project of working with the parent and toddler group and linking that with older people, and a bit of a surprise where it was one of the older ladies that jumped into the ball pool, not the children. So a nice example of how that can work and the energy that it can bring and the learning for the younger group and the older group. So that's some of the key things we've picked up that we would like to get the opportunity to develop. Within the report, we used the template that was given right at the start of the project. So the aims of the project, how you hoped that they would be delivered. So I've outlined how we feel we've achieved those, and the bit I would like to just highlight is how we would propose to develop those successes or gaps in the next proposed couple of years. Very much developing that navigator role and linking all the different services together and supporting people to use the services. So we've had a lot of examples of people needing a bit of support, maybe to attend a meeting, to understand their health needs and provision, to build up confidence to ask some of the questions about their care and support, and also to link people on the off islands and also with Cornwall wider. So, for example, someone coming for hospital treatment and not knowing, needing a bit of support to get to the appointment. So linking with our volunteer team or our hospital project to support someone to physically get to an appointment, or support for someone moving from the island who needed adapted equipment in their home. So linking with Cornwall Mobility. So very much linking people wherever it is they live, but obviously they're coming from Isles of Scilly. Very much looking at a base and a hub. So we're currently exploring local and grant funding to look at having a base that's more embedded in the community and more visible, and linking with partners. When we've joined the Health Watch event, we really saw that people wanted to come and speak to us. So really having a hub that we can support voluntary sector generally for people to come over and utilise, and have a base that people coming from off islands who will have limited time to do things when they come to Scilly, to the main island, that they can drop in and get support and get information. So having a more accessible space that we can utilise for the community as well. Using technology, I mentioned earlier the digital champion idea, and to really link with what's going on with the Smart Island project. and also linking in terms of forums. So we've got a small group of very engaged and enthusiastic volunteers who all live within the community and have great ideas and connections about what we can do to support people. So we're really keen to develop that, and also with an elder care forum, so everyone that's involved in supporting the older community on the island, how we can ensure that we're not duplicating work, that we're sharing our resources as best we can, and really hearing what it is our older community want and need within the Isles of Scilly and the Off Islands as well. We've just recently been trained in the NHS funded programme for diabetes prevention, which I forgot to say at the start in my update, and that's really very much a health prevention, a health promotion, a behaviour change project, and we will be delivering that. We've been linking with the team across the county, and it includes Isles of Scilly, so we'll be delivering that, linking in with the GPs and the practice nurses. So I think a natural network for people. Certainly we've started delivering that in Cornwall generally, and it's bringing people together. It's linking with, I was interested to hear about Health Watch, about the gym, and some needed a bit of support for people to exercise. So that would be, we would see natural links coming from that diabetes prevention programme. And understand there's quite a significant number of people on Isles of Scilly who are being put forward for that. When we met with John, he thought there was about 90 people on Isles of Scilly who were deemed to be at risk of developing diabetes. For future, we definitely want to be continuing the work with the MDTs and that coming together, sharing and supporting people. And as Aisling said about the social prescribing, we're very involved in that approach across the county. So very committed to that, how we can fill the gaps and support people in the community. And how we link, I've been in post working with the Isles of Scilly project just since February, but a key part of the role I feel is linking with the whole organisation and ensuring you've got that best value that you were talking about earlier, Aisling, in terms of the helpline, the online portal, the skills and expertise and the learning that we have within the whole organisation, but also the learning, as we were saying, the unique way that you work on Isles of Scilly. There's great learning for myself and my team here as well. So we're really keen to foster the work that's already been done, and creating the networks, and then looking for the future to develop that further and really support the work within the community.
Thank you very much. Yeah, it's very helpful, very useful. Aisling, did you have a comment?
Yeah, I just wanted to thank you very much, Sheena. As you know, because not everybody's been on the Health and Wellbeing Board in previous meetings. So when we were looking at best care funding schemes, I think way back in February, when we were kind of looking at kind of draft proposals, this project, it was proposed that we maybe didn't continue this project because while we know this is a great idea, we had found it hard to deliver it, and for a variety of reasons, which aren't just solely to do with Age UK. You know, it was a whole partnership worry, and obviously there's a whole kind of thing with we've got budget constraints. No point investing in a project if we don't believe it's going to make the difference we want it to. Since then, we've seen a kind of real kind of lift in energy and a kind of and what's coming through, and I think that just is natural evolution of the project, and maybe we can think on that and reflect in the future. If things are going to take us 18 months, how are we going to work that through? Because we're going to have to all sit tight for a year where we're not seeing what we want to see for all sorts of projects. So we are really seeing stuff now. But we did actually decide to kind of came up with a compromise that we would fund this project for another 6 months, i.e. till September, and evaluate then. I've obviously, as we're going to discuss in a bit, got to put forward scheme proposals for the next 2 to 3 years. I know for sure that Living Well It's a fantastic project and absolutely right for Scilly. I know that Cornwall Council's Better Care Fund didn't feel that they were going to invest in it going forward, but that's because they've got lots of competing demands. But I just believe, looking at similar models in children's services, I'm really into this prevention stuff, social opportunities. I think getting together with your friends and having a laugh is probably going to be the most significant contributor to health and wellbeing on the Isles of Scilly, and that's what I want this to be about. So basically, members of the Health and Wellbeing Board, what is your thinking? I feel September is becoming a little unfair because that's next month. I think there's some really good ideas here that we need to test, but I will have to be honest. Over 2 years, we've had 2.5 years now, nearly, of this project where it's not quite started singing in the way I wanted it to do. So this is up to the rest of you board. What do you want to do? Do you want to give it a good go for another year or the 2 years? Don't forget that where we've described this project in the scheme proposals, I think the idea is always right. So what we might consider is when we look at the next bit of evaluation, if it's not working, is there an alternative delivery model? So that might be a way forward so that we can keep the scheme proposal broadly in there, couldn't we, Jill? But reconsider the delivery model if we're still struggling to kind of get what we need from the community. But I mean, for example, since we last spoke at the Health and Wellbeing Board, we've now got 5 volunteers. And I know that's a conflict for Jonathan, but actually it's fantastic. You know, getting those people on board is significant, actually, because one person can't do it on their own.
No.
So, proposals, really.
Councillor Grottick, you wanted to feed in?
Thank you. There's a lot of good ideas, and no one is denying that there's good practice and that, you know, aspects of living well is really good. But we are in a very difficult financial situation, and the numbers are extremely small. Therefore, the 5 volunteers coming forward are going to make a material difference. Because my understanding was that the idea for Living Well was that the coordinator was a catalyst to actually get the local, if you like, the local volunteers would actually own the project and almost drive it forward, and therefore obviously the cost implications, because the salary would not be there, would be much less. Can I say, little way, these 5 volunteers might then take over more responsibility, and we could then look possibly at possibly rejigging some of the delivery of the project. May I suggest perhaps we re-evaluate in January? What would you think of that, Aisling? Because several things seem to have come to the fore just in the recent last couple of months.
I mean, so it's really not up to me. All I'm saying is
no,
because
but I value your advice.
Yeah, absolutely. I mean, I think.
I wouldn't be happy signing up for another 2 years or even 1 year. I think it does need closer evaluation.
That's fine. And I think the thing is, it's about the governance, because basically what I'll talk about in the next paper is that every quarter, all providers who are delivering services funded by a Better Care Fund need to provide me with information, which is quite robust. So we know exactly what everybody's up to. And I think what we need to also have a process is of review, because it's not going to match Health and Wellbeing Board meetings. I send it round, and actually we are able to make some decisions sometimes that actually, great as projects are, is it the best value for money? Because, for example, one of my schemes is going into Park House, which, as we know, is actually a very important cog in the health and social care system. If we're talking about better care, it's about supporting Park House. So I am looking at all these projects, which are all enhanced services and all have value. Actually, could always do with that money myself for that particular service, which does kind of underpin, you know, the impact on the health system if Park House shuts is huge. You know, immediately in the community hospital, also on providers in Cornwall. So we're going to do this with all the projects. It's not just this one, but it's just poor Sheen has gone first. It's exactly the same with the rapid response one, which has been delivered by Helston. You know, unless I've got numbers and outcomes, unless we have those, then are we getting the right value for money? Because we're going to get pulled up in audit otherwise. So do we want to think about having a really big kind of... We're going to get the quarterly reporting, aren't we, Sheena, anyway, which I'll set up a system that... but then maybe January is a good kind of... It gives the volunteers and the coordinator a bit more of a run, doesn't it? Rather than saying September, which is next month. You can't get it all done by then, can you?
So I want to be fair. Is this the icing on the cake? Can we afford to have icing on our cake, or are we just looking at, quite frankly...
Well, if I could answer... Can I... Yeah. I think the networking bit, I can understand what you're saying. It might feel like the icing on the cake, but there's some core functions within the project, and also in terms of supporting people with the core parts of their daily living, with accessing services, with flagging up support needs and linking with the health practitioners. So I'd be really open to, if there's something that we can do differently for it to feel less like the icing and more like the absolute filling, then we want to be that core part of the community.
Ted Wilson?
Yeah, I fully. Oh, sorry. No. I fully support what Councillor Groddick has said, and I endorse the evaluation in January. Certainly, I think that's a reasonable idea. But on page 29 of the report, there's a bit there about exploring funding options. Is there any progress that you've got on that? Because if we implement all, which is great and it's wonderfully aspirational, a lot of it is, it's going to cost a lot of money, which we haven't got.
Well, we're currently, we've got an application in for funding to look at a hub, but obviously that would be, we would do that if we've got the post that's sustainable. We wouldn't then access that funding if it's till January, for example. So we have already got applications in and another one to be submitted next week for local.
Is that capital funding for a building for a hub, or is this revenue funding to see it going further forward?
It's to look at the having the hub having the space, so it's to look at funding to be able to the rent for the building. Yeah. Right. So that wouldn't be in the ongoing the core costs of the project. That it would be something we would fundraise for, but bring value to the project. And that's something we talked about when I was over Ashling, wasn't it? About looking at other sources of income, not expecting it all to come from this one source of funding, but how we can sort of utilise the wider organisation to enhance what we're delivering on Silly.
But everything else on the list is within the budget envelope, isn't it? So we've currently got £10,500 to end by September. Where we continue to the end of the financial year, it will be the 22, which is what I've outlined, because I still believe whatever we do, I do think somebody championing the social outcomes of our users at multidisciplinary team meeting is of value, because otherwise we're just going to get lost in medical transport and all that stuff and forget about the fact that people like seeing their friends and going stuff. So. But
and it's
I just need to see that. We just need to have the evidence, I think.
I was going to suggest that you may already be doing this, but when you go back to the vision about what this is actually the purpose of this project, and bearing in mind it's really sort of the first I've seen the details of it through this report, but there's some issues around. I mean, just for the evaluation and just the ongoing reporting is taking that satisfaction type survey off those individuals that you're working with around. How well do they feel they can live independently? How confident do they feel they can access services if they needed them? How isolated do they feel? These are the sorts of things, if we could capture that information that's on a scale of 0 to 10, and then you do it again after you've done some interventions and activities, that's what we need to, I would need to hear at this board to say, I'm feeling like we're making a difference. It doesn't matter now what you're doing, because actually you're helping these individuals move forward with their lives and they're feeling less isolated. And I think it's the qualitative stuff. Yeah. So having long-winded narrative about how well we're doing is not enough. You want some specific measures about what how you're improving the quality of their life.
It's about life enhancement, isn't it?
Yeah, and I'm just wondering whether or not you capture that survey sort of at the beginning of a conversation with the individual, and then again at a period of time after. So I'm just sort of suggesting it might be a way forward to get that data for you as well.
Yeah, and I think when we get to the Better Care Fund paper, I've kind of got a kind of spreadsheet of the kind of metrics I'm going to expect from each project. So there will be that numbers of people, because that's useful to know. But also there is that thing about improvement in self-reported wellbeing. So do we do the Warwick, Edinburgh, which actually Age UK do, but I think again it's making sure that data comes through to us and that we know for sure we're making a difference.
This isn't it.
So we do use those measurements as part of the Living Well project, and that was part of the survey we did previously, so we can share that information again if people feel they
But
would
it's
like
with
that.
each individual client that you need to do it with, not
That is what we do. We do it at the start when we start working with a person, and then as we progress with them to measure outcomes and impact. Yeah.
If I could slightly go off tangent, I agree totally with what you're saying, which is why I wish to make the point. I'm not sure whether this happening came through Age Concern, or the Living Well, but we did have a wonderful thing happened on our island, and it certainly came to the Off Island, which was brilliant. I don't know who funded it, but it's an idea of what you're saying. People want to know practically what is happening. And this wonderful thing was we had people from, I don't know where they came from, but they came to the island. They came for our coffee morning, they went all around the island, and it was concerning a really important thing for perhaps older people, and it was concerning your electricity meter readings and whether you wanted to change the tariff and why.
Anthony Ball.
I don't know who it came from.
So that's our commissioned winter wellness project.
Was it?
Yeah.
Well, it worked perfectly because the lady who came, she knew everything that we didn't know, and she looked at your sort of list for wherever you got your electric, gas or whatever, and could evaluate it and say, yes, and she actually rang the people up. We didn't have to do it, and she got quite a percentage of money off many people.
She does.
And I think that to me is a good project on the island. People can say something happened. The money, I don't know where it came from. Yes,
that's the problem.
So 10 people saved £500 on that.
Exactly.
The project, we paid that out of our public health allocation. The project is £1,000. So this is what we're talking about. So what we're saying is it's £20,000 for Living Well. So we need to see those stories.
It worked.
Times 20.
How close was they coming back? Maybe in October.
That wasn't part of it.
I don't know.
No, it's winter wellness. So it's our public health grant. So we have because I mean that's why Jonathan's here, because we know fuel poverty is one of the greatest impacts on the health and well-being of this population. So that's why Jonathan's here, and also there are going to be future links about health and social care. So as part of the public health grant, we don't have very much kind of spare, because most of it goes on all the prescribed functions. We've got a tiny little bit of room for error, because some of it goes to Active Silly to support those public health outcomes, and £1,000 we send to the Winter Wellness Partnership, which is hosted by Anthony Ball, and that brings over Cornwall Rural Community Council and all their chums, and they have a huge impact every time. They go into people's homes and explain to them exactly how to lag their loft, access this funding.
Switch tariff is the main one.
Absolutely, switching tariff.
She was so good at it, and she actually volunteered to use the phone and ring. And you could tell from her reaction and the reaction from the gentleman the other, they knew each other, and they knew that she was going to go forward with this, and she came out successful. It was brilliant, I have to say. Yeah.
I'm just conscious of time. Thank you very much, Sheena, for the.
Thank you for your time.
Thank you. I think it's going to sort of flow into the next item, but we've got a formal recommendation. Do we have a proposer and seconder just to accept the contents of the report? And development over the next 2 years is probably going to be subject to future discussions, isn't it?
Yes, I think so. Can we split it?
So have we decided on this?
I think you can just make a decision on the future in the next paper. The next paper is about future funding. I think Joel's absolutely right. This is the recommendation for specifically this bit.
Fine.
So we're just considering the progress. I mean, we would all agree to that.
Yes.
Okay.
So do we need a formal proposer and seconder for that?
Can you just clarify for me, sorry, that we're not actually deciding on the future development over the next 2 years at the moment?
No, I think we can agree that they are the right plans.
Yeah.
Then your next paper is whether you're going to...
Later on we look at affordability.
Confirm till when.
That's fine.
Yeah.
Okay. Fine.
I'll propose.
I'll second that.
All in favour? Thank you very much indeed. So that leads us neatly on to the next paper, which is agenda item 9.
Okay, well, let's look at page 35 as our framework for this. Now, all the other bits are to show you that in terms of governance, we're going to have each scheme will have a proper description about what the outcomes are. There's a lot more work to do, and I'm going to be doing that with Jill next week. We're going to get together, aren't we, with lots of chocolate, please. Get this. Then it needs to be underpinned by a narrative plan. The guidance did come through quite late. As you know, we are actually currently committed to these schemes, so we're at risk. But I think what most health and wellbeing boards are doing, as long as CCG and the LA are broadly in agreement, we're just going to keep going and cross our fingers. So I'm doing the narrative plan. There's lots and lots of work to do, and because we're a tiny little local authority, that's me doing it.
Well done.
Yeah, well. So just to go through the schemes, you will remember these schemes. These have been recurrent over the last few years, but I will just give you the heads up where I think we've got risks and what we need to do more of. So, mental health day services has sat on. I've got two overarching objectives, and it picks up on themes that we've talked about earlier. We've got a fantastic integrated care team, but in that team we've got some gaps in making sure that people can maintain their independence and have care closer to home. And that is mental health expertise. Now, our integrated care team meet every day, so we do not have mental health input on that level of frequency. And then also about physio assessment and planning, which actually we now do have, but it took us quite a long time to commission. Those, I think that makes you your golden team. If you have that level of expertise with social care planning and assessment, with primary care and with community nursing, I think you've got a really good team that can actually reduce acute admissions and admissions to residential care. So mental health day services, we've had this on the list for 2 years. It's absolutely based on what the community asked for. We did some really great clinical forum work, lots and lots of conversations with commissioners, lots and lots of conversations with the provider, and it's still not happened. So that's where I see a risk. Now, my huge temptation is, given my budget pressures, is, why on earth is a local authority endlessly trying to commission an enhanced service and not really getting anywhere? So I've got a great conversation lined up with Tracy Marsh next week. But that's where I see a risk to delivery. And we've had a risk to delivery over the last 2 years, and I've lost funding and had lots of trouble with both the Simon Bs have been cross with me because I haven't actually spent the money. So we've had to therefore realign it to other priorities. I just can't go through it anymore. Then reablement is what it is, and actually it's statutory, but actually now because we have that physio service, we have somebody who can plan that pathway appropriately. The rapid response and early intervention, that's that service that's commissioned through Helston at the moment. They've done a narrative evaluation report, which is there for information, because John Garman, who's the provider, has just moved back to the mainland, but he will be part of all this in the future. And I've given him the heads up saying we're going to have to be a lot more rigorous in the specification of that project. So thank you, Jill. Hours of service, numbers of people, etc. And it's not that there's an expectation that it's going to say 3,000 people were seen, but actually so we have some understanding of exactly what it is we're paying for. Access to services. Now, actually, we've had a long conversation about how expensive it is to get from St Mary's to Penzance, but actually on the islands it's quite tricky as well, particularly boating. So if you're an off-island resident and you know we've got particular concerns about the vulnerability of older people, to go shopping for a day on a scheduled boat is about £8 to £10. And so we have devised a scheme locally, a concessionary boat fare scheme, which gives 52 tickets a year to people so they have a trip a week to do what they like, and that might be shopping, seeing a friend, going to health appointments. There's a bit of administration in relation to that, and also around dispensing blue badges and the concessionary bus passes so you can have free travel on the mainland. And we also have Buzzer Bus, which is one of the most popular services we've ever commissioned. So I think that's an entirely appropriate thing to be funded through the Better Care Fund. It's a really fundamental kind of out-of-hospital service. It keeps people mobile, connected. The majority of Buzzer Bus trips are health-related. The value of that driver in people's lives is also hugely significant. And actually, Age UK have been fantastic at collecting that data. So I can give you the 2015 data. It'd be good to do it again. And potentially, Sheena, it would make sense if we did it for all these projects together, one survey, that we get a litmus test maybe in September of what all these things are doing to add value to people's lives. But the driver specifically is doing some kind of amazing social function here. Yes, it's a really great service. So I think that's an appropriate thing to fund. But again, I'll make sure that we have much, much more rigorous numbers and then you know exactly the breakdown of spend. It's broadly around 40 for the bus, broadly around 20 for the boat with a bit of admin. And then Living Well, as you know, we've discussed that at length. I've put in the broad idea to be funded over the next 2 years, but then there's as with all these projects, we've got to hold all the providers to account. So next time John gives his quarterly report, we'll need to see if it's rigorous enough. And again, if that provider isn't delivering it in the way we want it to, we know we need that scheme, but we will review who delivers. I'm just trying to sound really fierce. And then there's the disabled facilities grant. Just so you know, last year we weren't able to spend it all because the schemes in the pipeline. We always have nightmares getting builders, so that money's going to roll forward into this year. But we've had a good conversation, Jill and I, about whether that money could also, because normally its spend is locally determined, whether or not it might be eligible to be spent in Park House, because to be honest, Park House is the home of 5 people currently, and probably could do with a little bit of TLC. So we'll have that discussion. And then the last bit is the Improved Better Care Fund, which is the additional money that the Chancellor announced. And as you know, we agreed that that money would go into the pockets of our frontline care workers in order to make jobs in care more attractive and to send a message that we think that's where money should go rather than to commissioning black holes. I've done the Q1 return, and I think what I'd like to see over time is a reduction in the percentage of care hours being filled by agency staff.
Absolutely.
Yeah. That's not going to be actually an easy sum to do, but I will try with my very poor mathematical skills. But I think that's the only outcome I can really give you there. It's about making sure we have more and more of a permanent workforce. So that's like a romp through the schemes. I'm going to be putting a lot more detail into this. I've got to get the Arthur narrative plan to my colleague at Cornwall Council, Martin Boddy, by next week. If I email it round you all, are you happy just to say it's okay to go? And then and then I'll work on the schemes with Jill over August, early September. And again, would you be happy if I just emailed it round you rather than having another meeting? And then we can hit the submission deadline of the 11th of September. But I think today what I need is some steer about whether you're happy to progress all those schemes and how long for, so that Jill and I can then populate all these templates at the back. Thank you.
Councillor Grottick?
I still think we need more detail. I do think Living Well project, as I said, has good aspects. But somewhere along the line, we as councillors have to make difficult decisions, and we knew that in March over Park House. And I would like to see more empirical evidence, more evidence-based, before we take this Living Well project on further than, I don't know.
So much more detailed performance management on the impact, the outcomes, the value for money, what difference it's making to the individual.
Yes, because somewhere along the line we can't say yes to everything, however good it is.
I think the thing is, all of these projects currently fit within the budget envelope. I think the thing is, guys, if say in January we found 3 of our projects aren't progressing for various reasons, so mental health day services I still think is going to take a while. So can we have some flexibility? So last year what we did was, where projects could not be delivered through nobody's fault, or they weren't performing as well and we had to have a change in direction, can we agree that then that allocation could be scooped into high level needs, as we did last year? We put £25,000 into high level needs, which is Park House, because as you know, with Park House the level of fees does not meet the cost of running the service. So in terms of a kind of contribution from health, I do think it's a legitimate area of spend. It's just, I think the thing is, it's the level of risk of not delivering is what my worry is. So if we can then say to Sheena's team, keep going to January, which gives you some time, and then, do you see what I'm saying? Because otherwise we're kind of...
Yeah, I think with regard to the councillor's comments about the Living Well, we absolutely do need to get those metrics in. If it's any consolation, we have some pre-existing metrics from the scheme on the mainland, which we can apply to this more rigorously. Absolutely, it needs reviewing in January, because the difference with this Better Care Fund, it runs for a 2-year period. However, we have the chance to review that and change the schemes in 18-19. So I agree, it absolutely has to deliver what it needs to do, and we will scrutinise it, review, performance managing it a lot better than we have done.
Yeah.
Okay. So do we need to take a decision today on that or not?
So I think we need to. I think AGK needs to know what they're doing.
Well, no. All I'm saying is that we need to put the deadline as January rather than September.
Yes. I think that would be sensible.
In that case, I'll propose that we change the deadline from September to January, and then re-evaluate then and make the full decision then. Is that acceptable?
If you make that as a proposal, I'm happy to second it.
Are you happy with that?
So can I just clarify what we're doing today is we're agreeing a really high level indication of a scheme. Over the next few weeks we will work to give more in-depth knowledge and support to those business cases. You'll probably have to receive that dynamically to review for our submission in September. But the next iteration of those schemes will have a lot more information to support them, including the metrics, the performance, operational hours, things like that.
And the decision then made in January,
Yeah, I agree.
Yeah, I propose that.
And I've just got one question, and it may, I'm not quite 100% clear on the criteria for the Better Care Fund, but I just wanted to ask about the access to services with the concessionary tickets and everything. Does that apply to young people who are isolated too? Is it just older people?
Just older people.
And
65.
is that what the fund is only available for?
But there are other funds in place to support off-island young people and children and families to travel to
I just wasn't sure whether it was,
Okay, so I think we've got recommendation 1, recommendation 2, and do we need to add a third one just to capture what you said, Ted, about?
I think you've got it, haven't you, is that we re-evaluate in January and take a decision in January.
Fine, yes. Do we have a proposer and seconder for those?
A proposal.
I seconded. Oh, Barbara did.
All in favour? Anyone against? Okay, thank you very much. I think that's that item covered, and we'll look forward to lots of emails about.
Yeah, happy summer holidays.
Indeed. I think that concludes the formal part of the meeting. There's an report for information which John Garman's put together.
Just wanted to flag at one point that's come up within this discussion about access to services and isolation, and particularly for off-island. It's a very, very big issue in the winter. And we've had some discussion amongst councillors and in the scrutiny committee about looking at intra-island boating services. So I think we just need to link all that up because it's a very big issue, I think. And I'm sure Borough would concur with
That's
that.
fantastic. Because if that were the case, then you could have that. We could look at that pot being part of a bigger procurement idea.
Good.
Good.
Well, let's discuss that.
Good, and do it with school as well. Yeah.
And if we can
I think I think what you were just about to poke in and say about the school as well. I think that needs to all link in all together. So
They
that
would
we
love
can,
that.
Yeah.
School would love to do a joint procurement with you.
Okay, good. Yeah, let's keep the issue rolling on this committee.
But if the Health and Wellbeing Board can be a catalyst for some of those things which are in various different places to come together.
Very encouraging.
There's certainly been lots of talk this morning about all the different outcomes which are either being achieved or a work in progress. So I look forward to hearing those develop in time.
Yeah.
Okay, so I'd just finally like to thank everyone who's participated today, helped with the organisation. And I'm pleased the technology has worked as well as it has.
It's gone black.
I think it's time to run.
They've gone.
Time out.
Did we lose Caroline because she left, or because
She left. She said, "I'm going now." or
Oh,
something-
right.
Something similar.
Can I make a quick point? I know we've formally finished, but the problem with the Better Care Fund for new attendees is that you actually have to prove that